Hi, welcome to Lian's Corner, where we explore innovative solutions making a real difference in health and well-being. In today's episode, we shine a spotlight on United Medical Alliance Health Initiative, an organization dedicated to reducing health disparities and promoting accessible healthcare for all. So first of all, could you please introduce a little bit about yourself?
Hi, my name is Oluwaseun Bumi. I am a junior in Maple Grove, Minnesota, and I am the president and the founder of UMA.
Yeah, that's really amazing. So for now, we are moving on to the part one, warm-up session, like talking about personal motivation and vision for health initiatives. So what inspired you to start or take leadership in UMA's health initiative? Was there a personal story or moment that shaped your commitment to public health?
Yes, so I am fully Nigerian. My parents came from Nigeria and they were born there and raised there. So the reason why I took leadership over UMA was because of my parents and specifically because of my grandmother. In Nigeria, there is some healthcare issues, and my grandmother wasn't able to get adequate healthcare. And due to this, she died from preventable causes, and it broke me and my family's heart because this wasn't the only time that this has happened, and it's happened to so many other families besides myself. And I didn't originally put the foundations of UMA. My friends who were seniors before me did, but they had really had a vision for it to be a healthcare exploration club. And the reason why they started it was a reason similar to mine, which was because her grandmother in India faced stigma around women's healthcare and she wasn't able to get adequate healthcare, leading to her preventable death. And I took that vision and I decided that it wasn't right to just leave it as a healthcare exploration club, but rather a health advocacy organization. So with that, I've been working throughout the summer to turn it into the organization that it is. We have spread to over 15 chapters around the world, and we have been doing projects with autism advocacy, patient mental health advocacy, and we're looking to do more specific projects with lung and head cancer advocacy in Brazil and vaccination in Nigeria.
Wow, that is mean like there is an inspirational story behind your founding the project.
Open your mic, Annie.
I open it. Can you hear me? Can you hear me clearly? Okay. Okay, so it seems like there is an inspiration.
Open your mic.
Oh my, I open it.
Okay, so the next question is for you. Like, you're seeing the health landscape from a unique angle, and sometimes what the public talk about is very different from what experts notice. So I'm really curious about, from your view, what health issue today is the most urgent but still overlooked by society?
I think the health issue today that is most overlooked by society is the stereotypes built into the healthcare system and the systems in the world around us. As a council member for Gen Youth, a nonprofit that works to fight nutrition equity and also for physical activity equity, I've learned that the basic systems that are in the US and other countries that give different populations or people of color specifically less adequate food care and less healthcare in general have led to other disparities that are showing in other portions of society. And this does include healthcare. And while healthcare is my main focus, there is so many issues that press on today because of the stereotypes built into society that haven't left yet, even though we don't talk about it very much.
Yeah, okay, that's really good. So for now, we are moving on to part two, behind the project. So, you know that many communities nowadays struggle with health misinformation. For example, there have been many instances of information being shared about stroke prevention. I saw a lot on TikTok. So, how does UMA approach education and social awareness to ensure people can receive trustworthy and accessible information in real life?
So the stance that UMA takes on this is when we do our health education projects like Hidden in Plain Sight Project, Pulse, and UMA Collaboration, we don't just give people information, we connect people to information. So typically on the last page of the post, we will have other sources that you can talk to. So whether it's a specialist that they can talk to, or different websites that specialize in the information that we're discussing, whether it's eczema or cervical cancer, we're making sure that they aren't just using us as their only source of information. We're directing them to other reliable sources so that their information isn't only by one source, it's broad.
Yeah, okay, that's really amazing. Like, your project is creating many content for improving the health, and yeah, that's really amazing. So, Lily, is your question?
So like how is UMA adapting to the new trends in the public health, such as digital health technology, mental health awareness, or preventive care?
So with the new trends in healthcare currently, digital education, obviously. And we have adopted that through our Hidden in Plain Sight project. And not only through that, but through opening people's eyes to the other disparities and stereotypes built into healthcare. So with our social media, beyond our Hidden Plain Sight social media project, we do other advocacy where people can learn about different things that are going on. So currently we have a newsletter called Health Beacon where we talk about personal health, not just of people around you, but yourself. So we talk about nutrition, physical activity, and we're moving on to mental health care in our next episode. So making sure that we talk to people not about various issues when we discuss health in our social media posts, when we do digital health education.
Yeah, that's really good. So, for now, we are moving on to part 3, going deeper into the story. So, how can we distinguish trustworthy health information from information, especially on social media? Is there another way to recognize it?
Typically, information that is only from one source or comes from people who are not really experienced in the field, like maybe an influencer who just like thought that she knew a lot about weight loss or about mental health care. Making sure that your sources are from people who have studied the topic at hand and that have done extensive research on it. And beyond that, there isn't really a way to tell beyond just your sources, but making sure that your information comes from several sources and that you can fact check it on Google or Safari, or making sure that you know that this is widely studied, because one study doesn't make something true. Several studies do.
Okay, so you mean that we should depend on the reliable sources, right? And genuine data, or the people who is specialized in the medical field. Yeah. Okay, so and after hearing your answers, I have an extra question. Many apps promise better health, from sleep trackers to meditation tools. So in your opinion, how can we use digital tools wisely and effectively without becoming dependent on them very much?
To make sure that you're not dependent on those sort of tools or apps is to recognize that it is a tool. It is not your sole source of health education, not your sole source of health care or medication. It is a tool that you will use to better your health in some way, but it's not the sole one that you will use. So making sure that you understand that without this, you will still need healthcare, you will still need medication, and that you will still need to talk to someone who is experienced in that field. Because those apps, despite them being useful at sometimes cause adverse effects because people with varying diseases that may not need the same amount of treatment are using the same amount of treatment. So making sure that that is not your sole source of health education or healthcare.
Okay, so thank you for the useful advice. And yeah, Lily, it's your turn.
Yeah, so sometimes the smallest habits make the biggest difference. So I'm curious, what's a one simple daily habit that can significantly improve our overall well-being?
Through my work as a National Youth Council member, as I mentioned before, and through UMA, obviously, I've learned that nutrition is something that is heavily important, not just for your bodily health, but for your mental health and physical health. Being able to provide your body with nutrition and vitamins that it needs to be able to survive and thrive properly, especially for your immune system, for your recovery system. It helps to not only with your health, but it helps to build stability in other places. So yeah, that's one habit that I would especially would encourage people to adopt: healthy nutrition.
Okay, so you mean like healthy nutrition is the most essential thing in the daily activities of many humans. Yeah, I agree that too. That's good. Okay, so for now we are moving on to part 4, the health disparity, and this is the main objective of your project is aiming and targeting to help the people. So in your community, from your perspective, what are the biggest factors that create health disparity in your communities today, or that some people may not have full access to their health services or something like that?
I would say that food deserts in particular do cause a lot of the health disparities that we see. And beyond that, going further into that issue is the root of stereotypes. And I did talk about this earlier, but stereotypes is one of the main causes why a lot of health disparities exist. Like I said before, women's health stigma in India wasn't due to just not trusting them or something. It was due to the stereotypes that women weren't enough or women weren't as important as men. There was stereotypes built into the healthcare system that weren't addressed, and that's why so many tragedies were able to fall through the cracks. So making sure that we address those stereotypes and realize that it is an issue that is not only affecting people in surface level ways, but is deeply rooted in the system is something that we really need to address.
Oh yeah, that's an amazing point. Like stereotypes about the health, or something that is deeply rooted in the mind of some people in the rural area, a mountainous area about health. Yeah, that's kind of the best way to change health disparity. Okay, yeah, that's really good. And Lily, is your question?
Yeah, so if you look beyond the present, the picture becomes even more interesting. Like, so I would love to hear your prediction. Like, what do you think will be the most serious health disparity in the next 5 or 10 years?
I can't really say as I'm not a certified medical professional, but based on what I've seen, I think that with the use of AI rising as of current, there's going to be a lot of people who are self-diagnosing themselves and using things that haven't been prescribed to them by a doctor and possibly making themselves more sick than they already are, and not getting that adequate medical education and health care education is going to be a large issue from 5 to 10 years from now, because people will think that, oh, because it's artificial intelligence, that I'm going to be okay, that they're giving me the best information. No, it's not, because it's not personalized to you and your BMI, your healthcare, your situation. So yeah.
Yeah, that's an amazing point. So I have an extra question for you. Like, what health habits do you think are becoming more important, not less, in this fast-paced and screen-heavy world? Because nowadays many people are immersing themselves in their technology or screen times. So what do you think about it?
I think the biggest health habit that's becoming more seen in the world today is mental health. There are so many projects that are advocating for mental health, and it's becoming realized to be something that's a real issue. Before, there were so many mental health conditions that were seen as just sickness or something that was kind of demonized, but it's becoming something that's seen as like, you can get help for this, and it's seen as something that isn't the person's fault, but it's something that they were born with or given. So not only that, with like therapists, with medication that can help with with hormones and hormone dysfunction, with mental health, there's been so much improvement within the last 20 years that I would say that is one of the health habits that's become increasing.
Oh, yeah, I agree too that mental health is the most important problem in the many people like youngsters and children nowadays. Yeah. Okay, so for now we are moving on to the final session, giving advice for young creators or the teenagers. So you know that there are some people who want to start their long-term projects, community initiatives, just like podcast health project or the events or workshops to increase the health awareness for many people, but they don't actually know how to begin at first. So what advice would you give to these students?
I would tell them that there are so many organizations online and around in their communities that are targeting these issues, and they really need help. There's so many organizations that I know of in my community that I volunteer with, because organizations can't function off of one person or one idea. They need support, they need volunteers, and they need someone who believes in the cause and is ready to take time to work towards it. Organizations like UMA, for example, we have community ambassadors who start chapters and do projects with us, like autism advocacy or patient mental health. And there's also other organizations that I know of that have projects that you can do, and you can simply start with one application or one Zoom call.
Okay, that's a really useful advice. I hope that our audience can get it to start following their own project in the future. So Lily, is your question?
Yeah, so if you could redesign how students will have awareness outside the classroom, what would you improve first?
I would improve making sure that people don't believe everything that they see, because people see it on social media, and oftentimes people's belief on what people see on social media is often what they take to heart. Making sure that there is ways to understand that this isn't reliable information, or that this isn't really supported by other sources. The things that are seen on social media might just be seen by one person to work for them, but studies are done to prove these things and to study these things in a wide variety, in a wide population. So making sure that you're trusting reliable sources and reliable methods of testing these sources.
Yeah, okay, that's an intriguing viewpoint of yourself. So I have another extra question like, okay, yeah. So nowadays, many people are really busy for their own work and their own studying journey. Although many organizations try to advise them, motivate them to start doing exercise or taking the healthy habits in everyday life activities. But I think giving advice is just kind of the thing that may have the big impact or may not on some people because they are busy, they don't have time to focus on so much on it. So do you think that is there another way that can motivate them to start living a healthy habit more than giving advice or something just like a post on social media? Yeah.
I would say to get someone to be motivated for themselves is something that's really hard, especially when there's no incentive that's bringing them like money or fame or social presence. There isn't something that's pushing them. But making sure that people realize that their life, whether you're like able to continue doing what you do, is based on your body. And if you overtake your body and you overwork your body, you will not be able to do anything that you're doing. None of it will matter if you're not taking care of your body, and helping people realize that not everything goes on for forever, and that you need to prioritize your health for you to do things that you love is something that we could start incorporating into health education to make sure that people are actually building those healthy habits. And beyond that, just giving people reasonable ways to start doing this, because oftentimes people just say eat healthier or exercise, but they don't give them a actual way to do that. So building small habits and kind of building them up as time goes on will also help people build those things, and just keeping a mental consciousness of, oh, let me eat healthier, let me get like a little salad, or let me eat that fruit. Just making sure that you're mentally aware that this is what I need to be doing.
Okay, that's a detailed answer for my question. Yeah, that's really wonderful. That's really intriguing. Okay, yeah. So I think this is the end of our talk show today. And I'm so grateful for you having time today. Your energy, your story, or have truly added something to our episode today. And it's our honor to have you being here. Yeah, that's an amazing opportunity to talk to you about the health disparities. And this is the first time that our podcast is talking about the health. Yeah, so we are so honored to have you here.